All right, we want to look at this now. It's the health care crisis looked at from a completely different angle. More unemployed Americans are now turning to free health clinics. And in growing numbers, they're being turned away. Who are the people that are relying on these services, and what happens to them now? Sheri Wood faces that overwhelming demand at the Kansas City Free Health Clinic. She's also served as the president of the National Association of Free Clinics. Let me just take you through your experiences. Tell us, we hear about these 47 to 50 million Americans who have no insurance in this country. You deal, I imagine, with some of these people every day. Who are they? What are their needs? Tell us about them.
We do deal with this every day. These are people just like you and me that just happen not to have health insurance. Most of them are people that work and are now really trying just to make the ends meet and take care of themselves and their families.
And what do they come in for?
They come in for everything from sinusitis to hypertension, diabetes. We have HIV patients. We have people that are coming in for behavioral health assistance that are really dealing with a lot of stress and issues that are affecting them and how they can go through their daily life.
A lot of people would argue, look, when you hear people say that there are 47 million Americans who are uninsured, that means they're uninsured. That doesn't mean they don't get health care. Any one of those people who's going to your clinic can walk into an emergency room anywhere in the United States and get indigent care. Right? So what's the difference?
Right. What we're trying to do is keep people out of that emergency room because that costs everyone money if that happens. You can figure about $1,000 out of your premium for health insurance is going to cover the uninsured. And so if we can take care of them when they're not as sick and it costs less, plus it's much less stressful for them, then it's a lot better for everyone.
So what you're saying is having clinics like yours, in this case they're free, and I imagine somebody has to take the burden of them, but in the future, right, the government might be involved in something like this, in the end makes healthcare cheaper because of prevention. Is that what I hear you saying?
Absolutely, and most free clinics do a lot of prevention work. We run diabetic support groups so that we can help people learn about their nutrition. We really want to help them take care of themselves. And we get people back in for routine checkups so that we try to prevent the onset of some of the chronic diseases that cost everyone so much money and are so hard for people individually to deal with.
Would you like for the Obama administration to come up with a plan that puts you out of business?
That would be wonderful, but even with all the plans that are circulating, there's still going to be people that are uninsured. Right now, with 47 million people in this country that are uninsured, even with the plan, it would leave about 10 million people that are still going to need care.
Sheri Wood, you're fabulous. Thanks so much for taking time to take us through this. We appreciate it.
Absolutely.